Hello, hello, everyone. I am here tonight to start our webinar. I'm also on Instagram Live, so hello, everyone that is joining us there. I've been doing this multitasking thing now on Tuesdays, but it's been nice to have people that are on the webinar, but also people that don't know about the webinar to learn about it through the Instagram Live. So today we're actually going to be piggybacking off of some of the things we've been talking about this month. It's really been all about different types of mental health conditions. And last week we dove in and really talked a lot about depression, anxiety, and even addiction. And howdy over there. And I felt like that was such an important topic to touch on because unfortunately so many people are dealing with depression and anxiety, especially anxiety. I'm hearing it left and right and in very, very young ages as well. So with that being said, when we talk about, these different imbalances that can cause us to feel low, feel depressed, or even feel anxious, this is actually very tied to also some of the sleep disorders that we could be dealing with. And I think that so many people are struggling with their sleep. Some people, it's the full-blown insomnia. And then there's other people that are really just dealing with broken sleep or never necessarily waking up refreshed or popping up in the middle of the night. And what's really fascinating too is if you actually look at the Chinese medicine, it's called the organ clock. Every 2 hours of the day, you have different organs that are regenerating. So if you pop up at the same time every night, or even if you crash the same time during the day, this is usually tied to an organ that's under a lot of stress. So one of the most common things that I hear in my clinical practice is people waking up between the times 3 and 4. So 3 and 4 a.m. is actually tied to your liver, which unfortunately in this day and age, most of us are dealing with some type of stress on our liver. And everybody thinks alcohol when I say this. And I'm not necessarily talking about alcohol, but medications, caffeine, alcohol, pesticides, herbicides, any type of toxin has to get filtered out of the body through the liver. So the liver is constantly dealing with the brunt of so many different things. So it's really important to take care to your liver. And also, if you are popping up between 3 and 4 in the morning, kind of keeping that in mind. For those of you that have no idea where the liver is on your right, like it's right by your right rib cage. So some people have a lot of pain there. So sometimes it could be your liver, sometimes it could be your gallbladder, just so you know. But the second most common time people are getting up is going to be after that. It's going to be between say 4 and 5 a.m. And that's actually more lung related. So if you're someone who's had a history of upper respiratory infections, bronchitis, things like that, this can actually be tied to why you are waking up at that time in the middle of the night. So the body is so fascinating, and really what I want to uncover today is I want to be able to talk more about these sleep issues, because unfortunately what we're doing is we're usually grabbing for some type of medication, and then for those of us that are trying to go the more natural route, we're utilizing things like melatonin. And then the more we use melatonin or even our medications, we usually need to up our dose, or we eventually need to switch the what we're using because it stops working. And it stops working because we haven't necessarily been able to figure out or address the root cause. And really, some of the things that I'll tell you tonight is that it's not super black and white. There's no one rhyme or reason to why people have sleep issues. There are many reasons why. And as I go through the examples, you guys should be able to decipher, which is maybe more appropriate for you, because everyone is going to be obviously a little bit different. So for those of you that are on the webinar, and for those of you on Instagram, we have a webinar which I have all these amazing slides, so you actually get visuals for everything that I'm saying. But for those of you that are just on Instagram, you can join us next time. I do these every week. Okay, so just kind of a little bit about what we're going to cover tonight is we want to talk about just understanding that you don't know what you don't know. There's very limited testing when it comes to sleep. doctors are transmitters. They're not necessarily going to the lengths of doing any type of MRIs or CAT scans or imaging to look at the brain to see if that's associated with sleep. So really what it comes down to is, oh, you have bad sleep, here's your sleeping pill. And there's not a lot of testing, so it's very difficult for people to understand why. Secondarily is if you're trying to fix your sleep, it's not always about what you do or what you take, but it's also about how you do it, because you have to consider there might be various factors playing into why your sleep is off. And then we also want to really look at some of the limitations to the approaches. So I've already kind of mentioned how, you know, it's usually going to be something natural like a melatonin, or it's going to be a sleeping pill. There are so many other ways that we can go about really helping our sleep. And some of the difficulties with our sleep can come down to the way our bedroom is set up and some of the things that we do before we go to bed, which we're going to cover. So just a little bit about myself, a little bit about Integrative Wellness Group is, you know, we really have learned a lot over the course of our clinical practice, and we kept seeing a lot of limitations with the way that medicine is looking at the body. And what I mean by that is we look at the body as being a bunch of separate parts. So when you're complaining about your sleep, it's kind of just thought that, oh, you just have a sleep problem, and that there's no other possibility that there's other organs involved, or there's more of a root cause to it. It's usually just like, oh, well, change your schedule, oh, get to bed earlier. And it's not usually that simple, and especially because we're so overly stimulated in this day and age. So we really kind of push the boundaries, and we're always digging to just try to understand, you know, some of the origins to why people feel the way they do. And we've uncovered that there is a lot of limitations with the testing, and there's also a lot of limitations with the treatment protocols. So we really opted to spend more time, ask better questions, dig deeper, so that we can truly uncover what is the cause and then be able to obviously give you a solution, because that's the most important. So a little bit about myself. I am an integrative physician. I work at Integrative Wellness Group, working primarily with a lot of complex cases. The reason why I'm comfortable saying that I work with a lot of complex cases, because I really do such advanced and comprehensive testing that I have the ability to uncover what is the root to your symptoms. So it's not about, you know, naming and blaming and just saying, oh, this is your diagnosis, this is what you have wrong with you. It's really a matter of what caused it. What, you know, where are these symptoms coming from? And when you do the right testing, you can do that with confidence and then be able to know exactly how to help this person. So I can work with a lot of different populations. And the reason why is because my testing and the way that we look at the body has the ability to unravel really what is the root cause. And that's the absolute most important thing. So a little bit about why I even do what I do. I don't do what I do because I was really sick. I actually thought that I was a pretty healthy individual. I really thought that I ate well, I was conscious, you know, I was definitely healthier than a lot of the people around me. And when I actually got into this field and I started doing my own testing, I realized that I wasn't actually very healthy. And I realized that a lot of the things that I dealt with on a day-to-day, some people, you know, or some of my symptoms were on a week-to-week basis, I found that I just normalized them. So, you know, occasionally having a stuffy nose was my normal, you know, having a headache occasionally was my normal. Having an upset stomach when I ate the wrong thing was normal. Having brain fog was normal. And this is the common thing for many of us, is we normalize the different symptoms because maybe they come and they go, but also because our blood work is usually saying that everything looks fine. And that's one of the biggest things that I've learned, is there is a lot of limitations with our more traditional testing. And because I did more comprehensive testing, it really revealed that I actually had massive mercury toxicity because I was a pescatarian for 10 years, meaning I only ate fish. I didn't know any better. I thought all fish was created equal and it was super healthy and good for your brain. Little did I know that I was eating tons of swordfish and tons of tuna, which is very, very high in mercury. And then on top of that, because I was eating so much fish, I actually had a lot of infections in my gastrointestinal system because I was eating a lot of raw fish doing sushi. So really the biggest thing is that you don't know what you don't know until you do your testing. And I think the biggest thing that I advocate for is don't settle for feeling mediocre. And especially because people that I work with are, they're young, they're in their 20s, they're in their 30s sometimes, and they're sitting there being like, oh yeah, I can't remember anything. Oh, always have to have a pad on me because literally my memory is shot, or I can barely get out of bed in the morning. On the weekends, I just try to sleep so I can recover from my week. This is not a way to live. We really need to start asking for more and demanding more out of our healthcare, because feeling like that now, how are we going to feel in a few years? So I know that it's late, and I know a lot of us got a lot of things going on. We got kids running around, people want dinner, we have dogs barking, and we probably have emails to catch up on and all the good stuff. But what I'm going to talk to you guys about tonight is not things that are traditionally being talked about. These are not just run of the mill. I'm not going to sit here and tell you that you need to go on an elimination diet. I'm actually going to give you information that you probably have never heard before. So with all the distractions around us, it's an awesome time to just shut down the email browser, slide the cell phone away, be able to kind of hone in, because this is really amazing information that is not things that you're hearing from other places, other platforms, and other physicians. So first and foremost, before we start talking more so about sleep, is I want you to know that it's not your fault that you don't know what you don't know. If you've failed at trying to get yourself better, and you failed at trying to choose the diet that's right for you, or you failed at, trying to pick the right supplements, medications, etc., it's not your fault. There is a ton of information out there. There is a ton of conflicting information out there. It gets very, very, very confusing on what is right for you, and even how to get started. So it's really just a matter of, don't blame yourself. Don't kind of allow that to make you paralyzed. It's really just being able to get the right information and be able to use it in the right way. So I think the most important thing is this slide for those of you that are on the webinar. I personally think that one of the biggest detriments to what's happening in medicine right now is the fact that we look at the body as a bunch of separate parts. And we're in the mindset of always wanting to work with a specialist, or being told that we need to go see a specialist. And if you really think about it, we have a cardiologist that's going to help us with our heart. We have a neurologist for our brain, psychiatrist for our mood and our mental health. And we're assuming that all of our systems are actually, they're working independently and not working together. And that is one of the things that keeps us confused, it keeps us paralyzed, and it keeps us from actually getting better, because nobody is piecing the puzzle together, and nobody is actually necessarily being able to tell us, hey, this is the root to the umbrella of different symptoms that you have going on. For those of you that are asking about the webinar link is actually in the bio on Instagram, and it's also on the website. So you should be able to actually hop right on there and join in. But again, you will be able to access the replay. So private message me if you want the replay, and I'll send it directly to you. Okay, so this kind of brings me to my second point. Is I just mentioned that, if you have something going on with your brain, then you're going to see a neurologist. If you have something going on with your gut, you're going to see a gastroenterologist. If you have depression, you're going to see a psychiatrist or a psychologist. So this is really just everything being separate, number one. And number two, this is just overlooking basic physiology. And really on the topic of sleep, so 90 to 95% of your serotonin is made in your gut. The precursor to melatonin is serotonin. So that alone gives us tremendous insight as to why we might be dealing with a sleep issue, also feeling depressed. Maybe it's low level, but then we also might be dealing with a low-level gut issue that comes and goes, or we blame it on, I ate too much pasta, I ate a big meal, I ate out, I ate too much dairy, whatever the case may be. So there is a huge, huge connection amongst all of our organ systems, let alone just the gut to the brain. So another big thing that I hear on a day-to-day basis is, why doesn't everybody do what you guys do? Why doesn't everybody use this type of testing? Why doesn't everybody, look at the body from an integrated standpoint? And the way that I answer that question is, if you think about the most common testing that we do on an annual basis, the most common testing that we do is blood work. And blood work is a chemistry-based test. So when we have compromised chemistry or a compromised biochemical pathway, then the way that we fix that is by utilizing chemistry-altering substances, which is what? Medication, pharmacology. So the majority of the testing that is being used on a regular basis is to look for broken chemistry that can be fixed with chemistry. So when you start to look beyond that and you start to use other modalities of testing, looking at DNA and looking at genetics and looking at diet and looking at neurology, it becomes a little bit different with your approach. And you can definitely get to the root and then be able to have a more comprehensive and specific approach. So this kind of also brings me to the last point on this slide, is that we look for the broken chemistry to fix it. And then we also are always seeking out what is going to be the one fix. What is the one pill? Think about every commercial. It actually makes me cringe when I watch TV nowadays, because the commercials are just almost so ridiculous when you really, really listen in. And it's pretty much proposing that, one day there's going to be one pill that cures a disease, which is just such an unrealistic expectation. But also secondary to that is, none of these one pill cures, they all come with side effects. So with that being said, it's not that the healing process has to be crazy complex, but it's more important to understand that it's multifaceted. We are multifaceted people. Think about, just the amount of feelings that we feel on a day-to-day basis. How many emotions do we run through by walking around, going to work, seeing an email, looking on social media? We just kind of ignore those things and think stress is stress, and we think that stress isn't going to actually play a factor in our physical body. But at the end of the day, we as complex beings, there's so many layers to why we feel the way we do. So a very interesting story is we had a patient who had 3 major symptoms, which are crazy common: depression, anxiety, and insomnia. Insomnia came and went. It was, she would have insomnia for, a couple of days, and then it would get better, and then it would come back, and it was really, really up and down. So what's so fascinating about this is that when we dug in and started doing her testing, one of the primary things that showed up was not necessarily that this person just had a lot of trauma in their life and a bunch of gut issues that maybe threw off, their serotonin levels. It actually was more so related to her vascular system. And this is something that is off of the radar so much of the time, because our brain needs 3 things, which I'm going to talk a little bit more depth on. But one of those things is the brain needs oxygen. The way your brain gets oxygen is by proper blood flow. So this was a person who actually had quite a few head injuries. She was a professional skier. And her head injuries were everything from just very minor bumps to 2 concussions, and then what they now presume to be post-concussive syndrome, and also CTEs, which is a chronic traumatic encephalopathy, which they're actually acknowledging now, especially in the NFL and with football players. So pretty much what it means is that there's inflammation in the brain way, way, way after the concussion or head injury. So what happened from all of these different injuries that she had, not only to the head, but also to the neck, is it started to alter the amount of blood flow to the head. And because of this, she started to have the early onset of what is actually called vascular dementia. So because her brain was not getting proper amounts of oxygen, her pineal gland was not getting proper amounts of oxygen. And this was actually leading to the inability to make melatonin. So this was a huge, huge culprit for her serotonin and melatonin being really, really low. So at the end of the day, for me to try to manipulate those pathways was never going to serve this person. It was about helping her actually recover from her head injuries. She did not wear a helmet. No, she was a skier a long time ago, I guess, before it was a thing. So it's just really important to understand that there is a lot of things to be considered if you're dealing with insomnia. It's not always necessarily just, oh, this runs in my family, this is genetic, this is hereditary, or, you know, I'm a poor sleeper. So one of the really cool things about what I do on a day-to-day basis is I get to really blow people's minds. I really love to see their mouths drop. And the reason why this happens a lot is because when I am talking with my patient, especially on their initial consultation, I'm digging and almost acting as an investigator, because I want to really try to understand, you know, what got them where they are. You know, what was all of the sequence of events that led up to it? Question, how do you fix something like vascular dementia? So it depends on the root. For this specific woman who actually had head injuries, one of the things that was actually really beneficial to her was something called craniosacral therapy. The other layer to it for her was she had a lot of lymph node issues in her neck. So we actually did a lot of lymphatic drainage with her as well. And all of that improved her vascular supply to her brain. We did other things, but for sake of simplicity, those were like the two major things that we used specifically for her. But again, when we work with people, we actually test their body to see what therapies are best. So some people that might also have vascular issues to their brain, we might treat them very differently. Okay, so one of the big things that is important is knowing that depression and anxiety are very different, and that depression and anxiety can be linked to your sleep issues. But your sleep issues are not just about a melatonin deficiency. It could be a lot more complex than that. And that the brain needs three things. So I've already started to talk about this a little bit. So your brain needs oxygen, which means it needs to get that oxygen from proper blood flow. The other thing that your brain needs is stable blood sugar. This is not about being a diabetic. Your brain is also in trouble if you're hypoglycemic, meaning you have low blood sugar. And if you're the person who gets hangry and you want to hurt people because you didn't eat, that also means you're probably hypoglycemic, or you're becoming insulin resistant. So with that being said, your brain needs stable blood sugar to function properly. And I'm going to tie that back into sleep. The other thing that your brain needs is stimulation. For those of you that are just kind of stuck, you feel very stuck in your job, you feel very stuck in your life, you haven't learned something new, you're not exercising, you know, you sit a lot for work, you're constantly on a computer, you're probably lacking tremendous stimulation for your brain. You might also be noticing that if you have to do a long drive, maybe it's 2 hours, maybe it's 3 hours or 4, that you're feeling physically fatigued from doing a long drive. And that's not physical, that's a neurological fatigue that's creating a pattern in your body. So it's very important to notice those subtleties. If you're the person that's like, oh, you know, let me read a book, and then you start reading and you're passed out within like 2 pages, that also means you have very sensitive neurons. It means your neurons are close to threshold. So the way that I classify that is, think about like if somebody slammed a book on a table, you'd jump. But if somebody dropped a pin, you probably wouldn't jump. When your neurons are very close to threshold, that little pin drop will fire. This is also people that tend to get ringing in their ears. It's called tinnitus. So you have to start taking these signs from your body and your brain to say, oh crap, I got to fix this, especially if you're young, because these are all signs that your brain is starting to, I hate to say it, but degenerate. I'm not trying to scare anybody, but it's the reality of it. So blood sugar, I want to go back to this. So when you're talking about blood sugar, high blood sugar is going to be people that are either pre-diabetic, diabetic, or they have insulin resistance. Insulin resistance, all that means is that when you get sugar in, if it's from pasta, if it's from fruit, if it's from candy, whatever it is, the insulin allows your brain and your body to use the sugar. But if your insulin is not working properly, then you have a bunch of sugar floating around in your blood that is making you inflamed, opposed to your body actually using it as fuel. So becoming insulin resistant is so common nowadays, and it's becoming more common because there's so much hidden sugar in all of the different things that we are eating. Even if you go and you're getting your almond milk latte that is, no added sugar, no syrup, no vanilla, no mocha, there is still a very high content of sugar just in the milk. So it's very, very important to know and be conscious of the amount of sugar you're being exposed to, and also considering that crackers and chips and pastas and breads all also break down into sugar as well. So the other piece of this is going to be the hypoglycemia, which is the low blood sugar. And I know that my whole life I was on the hypoglycemic side, and everybody told me that, oh, that's good, you have low blood sugar. And in reality, my brain was not getting the fuel that it needed. So the way that hypoglycemia looks is you're the person who wakes up in the morning, you have no appetite, so you don't eat. You usually grab for caffeine because you're a little foggy and you need the caffeine to kind of clear you up and make you be able to, get your crap together to get to work. Then, the coffee suppresses your appetite, gets to lunchtime, you're starving. And now you want to eat, as much as you can. So you'll usually grab for like the sandwich or a rice bowl or something that's going to give you glucose to spike your blood sugar fast because it's so low. Then you spike, then you crash, then you get tired middle of the day, you eat dinner, and then you want sugar after dinner. I say this scenario to many people and they go, I think you just told me my biography. I'm glad you liked that one, DJ. So with that being said, it's very important for you to acknowledge, are you the person not eating in the morning? Are you the person that says you're not eating in the morning because now intermittent fasting is a good thing for you? By the way, you're only supposed to intermittent fast 3 days a week max. Don't intermittent fast every day, because now you're pushing your body into hypoglycemia and you're going to actually further stress your neurological system. So outside of that, the other things to consider, if you're the person listening and you're like, you know what, I don't eat sugar, I'm super careful about it, but I relate to some of the symptoms that you're describing. So the other thing that you have to consider is you might have something stressing your pancreas that is affecting your gut. So what I mean by that is your stomach on your left rib cage, that's where you get, you can have bacteria get into your stomach that causes indigestion and heartburn, burping, things like that. But your stomach and your pancreas are embedded together. So very easily, if you've had bacteria get into your stomach, you can have that start to affect your pancreas and start to throw off your blood sugar. So then you're the person that goes to the doctor, you get your blood work drawn, and they tell you you're pre-diabetic, but you're sitting there being like, I don't get it. I don't even eat sugar. How is this possible? So it's more so that your pancreas is stressed for other reasons opposed to it just being dietary. So that's a very important thing to understand. So number 2 is oxygen. So the oxygenation to the brain comes from blood flow. There are a lot of different factors that play in. So the person who has the low blood pressure, this is also the person that's being told, oh, that's good. It's good to have low blood pressure. If you have low blood pressure, then chances are it's very difficult for your heart to pump blood against gravity into your head. So having low blood pressure could be leading you to having Raynaud's, bad circulation in your hands and feet, aka you always have cold hands and feet. And that means if you're not getting blood to your hands and feet, you're also not getting proper blood to your head. So it's very, very important to understand that having low blood pressure, cold hands and feet, or Raynaud's is also playing a very big role in why your brain might not be working at its best and you might be having sleep issues. On the flip side to that, we also then deal with hypertension, which is the high blood pressure. The people that have migraines, headaches, pressure in the head, those are people that are actually dealing with high blood pressure in the vessels of the brain. There's a lot of reasons why this happens, and I don't have enough time to go into it in depth, but some of the most common causes of hypertension in the head has to do with a lot of congestion in the neck. A lot of this congestion comes from the people that had a lot of strep as a kid, had a lot of ear infections. They constantly get swollen glands, or they're always getting upper respiratory infections. All of those things can play a very big role on creating a lot of issues with the blood flow in and the blood flow out. So these things can play a massive role in people that have migraines, headaches, visual issues, dizziness, vertigo, ringing in the ear, also known as tinnitus, in addition to sleep issues. So lastly here, we have stimulation. So I've kind of gave this away already, but for those of you that are getting physically fatigued by reading a book, by driving a long distance, this is showing that your neurons are very, very close to threshold. So again, instead of you being, jumping because somebody slammed the book, now the pin drops and you're jumping. That's what I mean, is that your neurons are super, super, super sensitive. So you're going to fatigue them very easily. So if you're the person that is getting extremely fatigued by doing the most minor things, it's neurological. It's not physical. And you need to start thinking about or if you can think, but you need to seek out what is going on with your neurological system. So exercise is such a key thing to utilize when it comes to stimulating the brain and improving some of the neurotransmitters, but also learning something new. Read a new book, take a dance class, or whatever, feels good to you. But learning something new is just so, so important for the longevity of our brains and also reducing the risk of dementia and Alzheimer's. So last but not least is role of toxicity. So some of the major things that also stress out our neurons and our neurological system is toxins. So I mentioned earlier, for those of you that have been listening the whole time, that one of my primary things that was revealed through my testing was I had massive mercury toxicity. So mercury, as well as aluminum and many other heavy metals, are neurotoxic. They are extremely toxic to the neurological system. So if you just think about dental work, so those silver fillings that go into your teeth, or even the silver fillings that you had for 20 years that were removed, that was silver amalgam, also known as mercury. So think about the proximity of that mercury to your brain. And that is going to play a very significant role on some of the toxicity that can actually affect us from a neurological standpoint. So taking into consideration, what are some of the things you're being exposed to just from dental work and fillings and implants and dental infections that can play a role in our brains? I have a question. Why would somebody not be able to tolerate hyperbaric oxygen therapy? There's probably a lot of reasons, but I would probably say the biggest thing that I would see is that the oxygen is creating a lot of die-off, and then the detox pathways are not able to get it out. This is the same thing for people that take antibiotics or a lot of herbs, and they're trying to kill, say, Lyme disease or viruses or whatever the case may be. And what's happening is, especially the lymph nodes are your massive filtration system of the body. So if your body can't get it out, then that is going to play a very significant role in having a negative response to something like hyperbaric, or even, different protocols to kill infections as well. So going back to sleep, so I mentioned already, serotonin makes your melatonin. So for those of you that are on, say, an antidepressant, you might think you're in the clear, but unfortunately, that's not necessarily how antidepressants work. They're called SSRIs. So all that they're doing is they're trying to keep excess serotonin in the synapse, or in the synapse, so that the neurons pick it up. So just because you have excess serotonin does not mean that it will have the ability to convert into more melatonin. The conversion actually happens in your pineal gland. So some of you may be aware, but there has been a lot of research that has revealed one of the major stressors on the pineal gland is fluoride. I know there's a lot of controversy on fluoride, but at the end of the day, everything in moderation. For us, getting a lot of fluoride treatments, getting them, every couple of months, it might be a bit excessive. In addition to fluoride is in your mouthwash, fluoride is in your toothpaste. So all of this exposure can definitely play a role in the pineal gland. During autopsies, they've actually found crystals of fluoride in the pineal gland of people that have had Alzheimer's and dementia. So this is just really significant to understand because this little change can really help you to potentially improve your sleep. So another big thing that is absolutely required for you to have melatonin production, darkness. So for those of you that are on your Kindle, you're on your phone, you're on your laptop, you're doing your emails till 2 in the morning, you can't do it. I know it's a techie world. I know it's super easy and convenient and you got to get stuff done, but you're screwing up your sleep. You need to take into consideration that it's not just about dark. It's not about the room being dark. The blue light that comes in through your devices is playing a significant role in altering your brain's ability to make melatonin. So you really need to consider, are you on these devices too close to the time you're trying to go to bed? Another big one is methyl donors. So in order to take serotonin and convert it into melatonin, you need a bunch of friends. You need a bunch of support. Those are classified as methyl donors. It's your folate, your B12. You also need things like zinc. So folate and B12 are actually absorbed in your stomach. So people that have had gut infections, they've had indigestion, they've had H. pylori, they've had GERD, chances are you're not absorbing any of those nutrients. And if you're the person taking B12 and you're peeing fluorescent colors, you're not absorbing it. You pretty much have very expensive urine, by the way. So it's very important to kind of know that it's not just about taking melatonin. If you are going to take melatonin, then you really need to make sure that you're getting your folate and your B12 and the other cofactors. The other thing that depletes you of folate is birth control. So a lot of us are depleted in folate just based off of that reason, because most women have been on birth control at some point or are on it as well. So another big thing too is the perfect balance of melatonin and cortisol. So they actually work inversely. So what's going to happen is going to be that you need to have cortisol going up in the morning to get you up so you're actually awake, but cortisol going low at night so that your melatonin kicks in so you fall asleep. So a lot of us are in this complete adrenal crisis because your adrenals make your cortisol. But something else that plays a significant role in your cortisol levels, which is one of your stress hormones, is insulin. So if your blood sugar is a mess, you will never fix your cortisol. So for those of you that are listening that you're on the adrenal fatigue train and you're taking all the adrenal supplements in the world, you need to consider, is your blood sugar part of the puzzle? It's very, very important to address that. So someone's asking me about blood pressure. How could someone increase blood pressure? So you have to make sure that you're appropriate for it, but licorice root is something that increases blood pressure. So that's definitely a good herb that you can utilize. I don't know why I'm doing this and not turning my head. Okay, so another thing about adrenals and the cortisol levels, and also another hormone called norepinephrine, because that's a very important hormone for your sleep, is your adrenals become very compromised by caffeine, nicotine as well, nicotine from cigarettes. So I know that it's this vicious cycle because we're tired, so we're drinking caffeine to try to get us through our day, but we're actually creating this massive negative feedback loop. So one of the ways that I transitioned from coffee is I started to use matcha, which does not necessarily give you that spike the way that coffee does. And that is a great segue to try to give your adrenals a little bit of a break. So it's really, really important to take that into consideration. Okay, so if you haven't realized by now, it's really a matter of you don't know what you don't know. Because if you don't do the testing and you don't know that your blood pressure and your blood sugar and the fact that you're not learning something new is all could be playing a role in your brain and in your sleep, you just don't know what you don't know. It's a matter of somebody, taking a look at you, doing better testing to uncover these things. So a big, big thing is that we need to stop accepting our crappy sleep and our fatigue and our poor memory and our brain fog as being our normal. We're just adapting our lives around these new symptoms, and we're not even asking for answers. We're just accepting that this is part of the aging process and that it's just kind of we're doomed to feel a certain way. And unfortunately, what normalizes it more is the fact that most of our friends and family also feel like crap. So you don't really have anything good to compare it to. So it's really, it's really interesting because all of my, friends and family, they're like, wow, you're the only one who's energetic and sleeps well and, feels good. And I'm just like, well, I'm the only one also doing something different. So it's really a matter of, if you know what is going on with your body can bounce back. So a couple of myths about mental health and sleep is that depression is always going to be caused by a serotonin deficiency, that there's also no reason for your insomnia, or the only reason is your melatonin. Anxiety is hereditary, and that you've also had all the proper testing to know where your sleep and your mental health lies. And then the other big one is that we have no control over our mental health because it's probably just genetic. So myth number one, depression is always caused by a serotonin deficiency. So I think this is really important because when we're dealing with sleep issues, a lot of times we're dealing with a low level of depression because the serotonin and the melatonin are so linked up. But it's important to know the difference between what a serotonin deficiency actually looks like and what a dopamine deficiency actually looks like. Because the people that are actually deficient in serotonin are the people that have kind of lost joy in everything. Nothing's making them happy. Nothing's making them excited. They have a great life on paper. They have a beautiful family and a great house and a great job, but they're not happy. Those are the people that truly have a serotonin deficiency. And then there's people on the flip side that have more of a dopamine deficiency. These are people that are really, they're not very motivated. They kind of are a little bit numb. They have a lack of concern for others. They feel very hopeless, very worthless, and they tend to kind of isolate themselves for that reason. The other interesting part about this, though, is that dopamine also has a huge tie to pleasure producing effects. So what I mean by that is dopamine deficiencies are usually tied to addictive behaviors. So when we have a dopamine deficiency, we're the person who's like, oh my God, I'm having a terrible day. Where's the chocolate? Oh my gosh, I can't wait to have a glass of wine. I need to go on my break because I need a cigarette. I'm so stressed. And everybody's different. Some people it's, wine, cigarettes. Some people, for me, it used to be a mocha latte. So it's not that it has to be, a bad behavior. You might be just using food. You might be using sugar. You might be using exercise, but you're utilizing those to try to mend a deficiency. The reason why they're called addictive behaviors is because obviously we keep going back to them. And the reason we do that is because the mocha latte or the cigarette or the wine gives us a very short-term dopamine high. And then once we crash back down, we want to go back to whatever gave us that high. So it's very important to kind of take those symptoms into consideration, because if you actually fix your dopamine, you might be able to quit the cigarettes, or you might be able to, give up that glass of wine every night, or you may be able to cut the sugar out of your diet. So it's very, very important to be able to decipher that. And on the flip side, when we're dealing with the serotonin, if you truly have the serotonin deficiency, most of the time what we're going to do is we're going to go on something to supplement. And that is usually going to be an antidepressant if we're going prescription route. And then if somebody is going the natural route, they might be using something like 5-HTP. So with that being said, when you're talking about neurotransmitters, they have to be in perfect balance. If you have too high of serotonin, you will be anxious. If your serotonin is too low, you will be depressed. So it's not a matter of trying to just boost it. It's about doing the right testing so that you can actually monitor where your levels are at. And unfortunately, so much of the time when I'm working with somebody who's depressed, a lot of times their depression is coming from another issue, which is sometimes oxygen issues to the brain, the blood sugar issues. And then a lot of people are dealing with this overload of serotonin, which is actually, they're confusing their anxiety with depression as well. So another telltale sign that you have a serotonin deficiency is seasonal affective disorder. We're kind of in the midst of it right now. We're in the winter, especially living in the Northeast, and a lot of people are, really wanting to run for the islands, and which is okay. But one of the big things about sunshine is it actually activates serotonin receptors in our skin. And that is something that boosts our serotonin. So being able to get out into the sun, even if it is cold, is such a way to be proactive about getting your serotonin up in a very natural way. And the same thing really goes for dopamine. If your dopamine gets too high, you can actually start to induce almost more of a psychosis. You can feel like you're losing your mind, or you can even be classified as schizophrenic. So it's very, very important to kind of know these signs, because either if yourself or a loved one is on a prescription and they've been on it for a really long time and they're exhibiting, massive anxiety, or they're exhibiting panic attacks or even psychotic behavior, you need to consider, have their levels gotten too high and they need to consult with their physician. So an interesting patient presentation was, there was a patient that I was working with that had constipation for almost 10 years. Patient also had depression and anxiety. So, constipation, depression, anxiety, these are three things that are unfortunately way, way too common nowadays. So getting into the history with this person, turned out they had a bad snowboarding accident when they were, I think they were in college. Resulted in a severe concussion, neck sprain, 13 staples in the head, no helmet. Constipation started shortly after, no big deal, kind of came and went. Then they actually moved into feeling a little bit depressed, but it was more situational. It was just like, oh, well, had a bad day, or, oh, broke up with a boyfriend. So had a reason for why they were feeling low. Had this mild dizziness, mainly when getting up too fast. Then actually started fainting around her menstrual cycle. Nobody was really able to figure out what was going on with her. Just kind of had these random fainting spells. Didn't happen all the time, but everything checked out normal in the testing. Soon after that, a little bit of anxiety kicked in. Then memory loss. The memory loss was a lot more related to the short-term memory opposed to long-term. Just kind of forgetting where the keys were, couldn't really remember, to-do lists and things like that. So with this person, it was multifaceted. It wasn't one thing. And I know it very well because it was me. And what primarily happened was a snowball effect. And this snowball effect happened over years. It was the injury. One of the biggest things the injury did was it compromised a lot of blood supply to my brain. And it was partly because I had massive whiplash, which created a lot of scar tissue in my neck. I also had a lot of scar tissue from the scar on the back of my head where I had the 13 staples. In addition to that, because of my neck sprain, I had vagus nerve damage. So your vagus nerve comes from the brain, but it innervates your lungs, your heart, your gut, your reproductive organs. And your vagus nerve does all of the things that you don't think about consciously, like breathe, have a heartbeat, digest your food. These are not things you tell your body to do. It's done automatically through your autonomic nervous system. So with that being said, this is what triggered the constipation. Constipation then triggered the lower serotonin levels. Then from there, started to kind of skip breakfast, was really busy, had a lot going on, started to move into this hypoglycemia, which started to now compromise the amount of glucose the brain was getting. And then last but not least was the vagus nerve also innervates the reproductive organs. So this was causing a lot of issues with the menstrual cycle. So when I was getting my menstrual cycle, the uterus technically inflames as it sloughs off the tissue. I know for the men listening, it's gross, but it's reality. But as that was happening, it was actually further irritating the vagus nerve, which was then lowering the blood pressure and causing the fainting. So this took a long time for me to actually figure out once I had the the testing that I do. But it was very, very fascinating because these were things that I learned to live with. I was really just normalizing and navigating my life around it. And, literally I was fainting and I was just like, oh, well, I just got to be careful that I don't, go for a run close to my menstrual cycle because I'm going to faint. And this is such a common thing that I hear on a day-to-day basis is that, something that extreme, we're just normalizing it. So another big thing that I wanted to touch on is that, you've potentially had the best testing for your mental health or your sleep disorders. So when it comes to the type of testing that exists is that we're usually just looking at sleep studies or we're looking at blood work and we're not going beyond that. But there are amazing modalities and technologies that exist. And one of them is something called a quantitative EEG. A quantitative EEG literally is a brain map. It maps out the hemispheres of your brain and tells you what's overactive, what's underactive, what's going on with your brain waves, because your brain waves will actually also dictate your sleep. So it's called a quantitative EEG. This is completely different than a traditional EEG. But the best part about it is a quantitative EEG actually then will give you the brain map and dictate how you can fix the brain through something called neurofeedback. And the best part is literally neurofeedback is a matter of wearing glasses, wearing headphones as the technology does the work as you're watching a movie. And it retrains the brain. It's almost like exercise for the brain to balance things out. So this is an amazing technology that's being underutilized, and it's something that completely transforms people's mental health as well as their sleep. The other thing too is we talked about serotonin, dopamine, some of these neurotransmitters. There's neurotransmitter testing. It's as simple as doing a urine test. And this way we can actually look at somebody who is potentially taking a medication or trying to supplement to see, are they actually deficient? Are they overabundant in the neurotransmitter? And, there's many labs that do this, but again, it's as simple as a urinary test. Some of the other tests that we utilize specifically is something called bioresonance testing as well as bioscan testing. So we look down to the DNA level to see what is stressing the neurological system, but also more importantly is what's stressing the body, because there's so many ties to sleep disorders. The gut can be a very simple connection. And again, for those of you that are just hopping on, it's because serotonin makes melatonin. It has to convert into melatonin. But 90 to 95% of your serotonin is actually made in your gut. So we need to kind of utilize the modalities out there to look at these different things. Secondary to that is we have the different things that can stress our brain to throw off our melatonin production is heavy metals. Mercury is a huge one. Aluminum is another one. For those of you that don't know, every time you put on antiperspirant, you're putting aluminum into your lymph nodes. So if you think like, how the heck in the world would I ever be exposed to heavy metals? You're being exposed. It's just the reality of it. It's in our antiperspirant. The silver fillings in our teeth have metals in them. The white fillings in our teeth have cadmium in them. Almost any type of dental composite has different types of chemicals in it. The other big thing, which is definitely one of my zones of genius, is infectious disease testing. So there are many things outside of toxins and heavy metals that can stress our neurological system and throw off our sleep. But some of the big ones when it comes to infections is Lyme disease. There's also parasite infections like toxoplasmosis. So for those of you that have ever been pregnant or you've ever heard this, when a woman is pregnant, they say, don't change the cat litter. And the reason why they tell you this is because you put yourself at risk for being exposed to a neurological parasite called toxoplasmosis. So this is not me just saying, oh, this is one in, a million people. Like, toxoplasmosis is very easy to come across and get exposed to. In addition to that, mold is another big trigger to neurological issues and sleep disorders. And then we also have infections like syphilis and Bartonella. I know those of you listening are probably like, syphilis, isn't that like eradicated? Syphilis and Lyme disease they look almost identical under a microscope, and it is very easy to be diagnosed with Lyme disease. But syphilis is something that I actually do see in my practice through the testing that we do. So it is not as uncommon as you may think. The safest way to get rid of heavy metals in the brain. The biggest disclaimer I would make is that when you're trying to detox from anything, heavy metals, mold, any type of toxin, you absolutely need to make sure that your liver, your kidneys, and your lymph nodes are being supported. So that means usually you have to do a combination of supplements, you have to do a combination of infrared sauna, and you also have to do a combination of herbs for your kidneys. Drink a lot of water, stay hydrated, electrolytes. You don't try to detox from heavy metals by yourself. Just don't do it. Use a professional, because the last thing you want to do is make yourself sick. And that's really important too, is if you are going through the detox process and you feel sick, you're not doing what's right for your body. It's not just you're supposed to be sick while you detox. It means that you're stirring things up that your body is not getting rid of, and it is starting to just circulate through your tissues and your blood. So it's very important to make sure that all of those detox systems are being supported. Okay, so on the note of these infections and how they can play a role in our sleep and overall our mental health, had a patient, he presented with sensory issues and gut complaints. Patient was about 8 years old. He had really bad sensory issues. Like, it was impossible for his mom to even get him to brush his teeth. So getting him to take supplements was going to be very difficult, but we needed to use something to help him with his detox process. So what mom decided would be best is if we would actually use a suppository for detoxification. It was called a glutathione suppository that we used specifically for this patient. Suppositories are little inserts that go into the rectum. Yes, I know, not the most glamorous, but that's what we needed to do. So as she was administering it, one night she reached out to me and she said, so I saw a worm. And I was kind of confused. This was very early on in my practice, by the way. I was confused because I did a stool sample and it came up clear. And so at that point, we decided to do another stool sample and another stool sample. And we did them from all 3 different companies. And never did one of those stool samples reveal that there were parasites. But what happened was that he actually had pinworm. So the limitation with stool testing is that 20 minutes after a bowel movement leaves your body, the parasites will self-destruct. So by the time your sample reaches the lab, they're pretty much going to not be able to find the traces of the parasites. So with this being said, parasites have a massive tendency to affect your neurological system. So for those of you that are listening and feel very kooky today, it is a full moon. And under a full moon is when parasites are the most active. So for those of you that have been moody today, your stomach has either been bothering you or you have terrible sleep tonight, it's time to get checked for parasites. And the point of this slide is not through a stool sample, because you need to use more elaborate testing in order to find them, because stool testing does not always reveal them. So it is very important to take that into consideration if you are dealing with depression, anxiety, or sleep issues. So I just want to let you know on the Instagram Live, I am going to get cut off in 30 seconds. Chelation is not very safe, so I would not recommend that. But if you want to learn more about detox, Glamour Organic Goddess, definitely check out our website. We have a podcast all about safe detoxification, so definitely check that out. Guys, if you want to be on this and you want to listen to the whole thing, definitely message me privately through the private messenger on Instagram so I can get you the replay. All right, guys. So last but not least, secret number 3 is you have no control over your mental health. So most importantly is when you know the root cause, anything is possible. And it's really just being able to be strategic in the process of getting better. And most of the time with the limitations in the testing that we've already established today, it's very difficult to figure out the root cause. Most of medicine is not necessarily digging for that. We're kind of just trying to acknowledge the symptoms and put a Band-Aid on them. So some of the things that are super important to get your sleep on track and to get your overall well-being on track is you have to consider the use of technology and the exposure to EMFs. So we are literally in Wi-Fi soup all day, every day. And one of the easiest and best things that we could do is try to cut down as much EMFs in our bedroom as possible. EMFs are electromagnetic frequencies. This is our Wi-Fi. This is Alexa. This is our cordless landline phones, our cell phones, our routers, all of these things. If you have cordless landline phones in your bedroom, get them out. If you have a smart TV in your bedroom, ideally, get it out. If you have a router in your bedroom, get it out. All of those things are literally going to create massive stress on your neurological system. The other thing too, gluten. So I know gluten is such a hot topic and everyone is thinking about gluten in relation to their stomach. They're thinking, well, it doesn't bother my stomach, so I'm fine. Start paying attention to if it affects you neurologically. So if you eat gluten, you go out and you have pizza or you have pasta or whatever the case may be, start to notice if your sleep is off, if you're fatigued the next day, if you feel foggy the next day. I know that this was something that was happening to me. It never hurt my stomach, but it created a lot of issues with my cognitive function. And the only way you're really going to notice is if you cut it out for at least a week and then you bring it back in and you start paying attention to those things. So it's not necessarily, if you're eating it every day, you're not going to be able to notice it because you probably feeling tired and foggy is your normal. The other big thing, going back to this hypoglycemia and balancing out your blood sugar, you need to eat breakfast. It is so, so, so essential to balance your blood sugar, to then balance your brain, and to get your circadian rhythms back on track. Exercise. Exercising pretty late at night might throw you off more because you're pumping up your endorphins. But if you're waking up, and I know some of you are probably so freaking tired, but if you can just be super diligent and disciplined and get yourself up and just try to do a little something in the exercise family in the morning, you will probably find that your sleep turns around more rapidly. And the other thing is learn something new. Being able to stimulate your brain in a new way is so, so important. And we need to do it going back to the basics. We need to grab a book. We need to read a newspaper. Trying to always learn on our computers or our Kindles and our tablets, it is going to further stress the brain, especially if you're doing it at night. So if you like to read before bed, try to transition over to an actual paper-based book. It will make a significant difference for you. So one of the biggest things that I've learned over the course of my clinical practice is that very, very rarely do things look like the textbook. And there is a lot of gray when it comes to medicine, diagnoses, and different conditions. Very rarely is it super black and white and that you fit the textbook. So this is usually where we start to have less and less options when it comes to getting better or bouncing back, because if we don't fit the textbook, then we usually don't get a treatment recommendation because you have to match the textbook. So if you don't match the textbook, then why should your treatment? So it's very, very important to dig deeper, to get better information, to really know what is the root cause to your sleep issues so that you can actually know how to fix it once and for all. So kind of talking about the old model versus the new model. So those of you that have been listening the whole time, you may have been looking at some of the, tests that I listed, and I listed out the bioresonance scan and I listed out bioscan. So I actually want to give you a quick visual on one of the technologies, because I think that explaining it is always a little bit more difficult than actually showing you guys. So let me hop over. I'm not going to be able to talk as I show you. It's only going to be about like 10 seconds. So let me just show you this, and I'm going to hop on and explain a little bit further. All right, everyone. So the video that you just saw was actually based on one of our technologies called bioresonance. So bioresonance is a technology that looks down to the DNA level by using frequencies. So with that being said, when you're looking at that video, the photos are obviously not the person that's being tested, but the icons that overlay onto it are representative of what's going on in the patient. So the very last one that you saw was actually looking at the vascular supply to the brain. So that's really one of the amazing things, is we're able to do this type of testing and get immediate answers and actually get a visual on what is going on with this patient. So with that being said, the specificity and the ability to piece the puzzle together is just so significant. And I like to show this because as I kind of move forward and show you guys a little bit more about how we do our testing, the way that we do our testing is different. And the reason why I started to branch out and look at other modalities of testing is because a lot of times what was happening in the very early stages of practicing is you would come in, we would do our initial consultation, and then I would have to use all these different private labs. And the private labs would be everything from stool samples to nasal swabs, blood testing, neurotransmitter testing. And a lot of the testing would rack up to thousands of dollars. And it didn't feel good to me that somebody was investing thousands of dollars before they actually were able to know what was wrong with them. Because in my mind, the most important thing is getting better. And I want people to put their funds towards actually getting better. So I wanted to figure out ways that I could get more accurate information in a faster amount of time while keeping the cost down from a diagnostic perspective. Because literally the diagnostics can rack up to $4,000 or $5,000 sometimes. And, if you look at most other functional medicine practitioners, they will tell you, oh, you can come see me for, this consultation fee, but your labs are going to cost, anywhere between $2,000 to $5,000. So it's very important to kind of know that there is an expense that goes in, but we really try to, first of all, give you more accurate answers in a very short amount of time, but to do that at a fraction of the cost so that you have the ability to actually spend money on the most important, which is getting better. So that's why I call this functional medicine versus integrative medicine, because we're now really looking at the integration of how the body systems are working together. And we're not sitting there giving you an elimination diet with a supplement protocol. We're actually looking at you as an individual, and because of the testing, the bioresonance being one of the technologies, we have the ability to customize and personalize the approach, because we have the ability to test what your body needs the most. So your supplements, your herbs, your remedies, your therapies, those are all tested against your DNA to see what your body is going to get the most benefit from. And when we look at the body from an integrated standpoint, we're actually going to, maybe we'll work with you and do detoxification. Maybe we'll be working with your gut. Maybe we will be working with your neurological system. It depends on what your testing tells us. So another big question I always get is, how does insurance work? And we serve people. We do not serve insurance providers. And that's how we're able to do what we do, and we're able to give the time that we do. Just based off of your initial consultation and the second visit with me, myself, Sam, or even Dr. Nick, you get 3 hours with us to not only dig deep into your history, but then to go over all of your results and give you dietary recommendations and give you a plan of action. So I wish that we had the ability to be in network, but we are out of network because we want to have the freedom to do what is best for you. So people do use flex savings accounts and health savings accounts and all of that good stuff, but we really wanted to make sure that we had the out of network freedom. So the biggest thing, though, that I think is an important disclaimer is that you do have your blood work go through your in-network lab. So that is completely covered by insurance, which is fantastic. So I think one of the biggest things that I realize on a day-to-day is that we forget that healthcare is about answers and solutions. We've kind of settled for getting a diagnosis, which is merely a description of our symptoms. Chronic fatigue syndrome, that means you're chronically fatigued. Irritable bowel syndrome, you have irritation in your bowels. We've settled for these diagnoses, and we've settled to kind of think that we just have to live with it, or our only option is medication and then eventually surgery. So getting back to really knowing that you deserve to understand the root is most important to us. And that's why we do all of these different types of tests on our onboarding process. So with our onboarding process, you are going to get your initial consultation with your bioresonance scan, which is that scan that I previously showed. We're also going to be using a different technology, which is a meridian-based technology. I call it computerized acupuncture. And it actually scans the different meridians of the body and looks for everything from food allergies to chemical allergies to look at the body from a little bit different of a perspective. We also are testing regularly for heavy metals, mineral deficiencies, vitamin deficiencies, and our blood work is as comprehensive as it gets. We're testing everything from your thyroid to your hormones, autoimmune conditions, mold markers, the list goes on. And one of the other things that I absolutely love about what we do is the autonomic response testing. We can test for so many different things with the autonomic response testing, but the most important is this is our valuable tool for how we decipher what is your personalized health plan. What supplements does your body need? What types of therapies does your body need? Because your body is completely different than someone else's body that potentially has the same diagnosis or even the same symptoms. Everybody's needs are different. So using a cookie cutter approach is not going to work. So, one of the things I wanted to do was try to create value with some of the different tests that we do. But it's so fascinating because when it comes to the people that you have now been classified as being or having a mystery illness, you just being able to know what's wrong with you is priceless. If you're the person that can't sleep and nobody can figure it out and it's literally deteriorating your quality of life, getting your sleep back is priceless. So depending on what your goals are and what you can achieve, it's really priceless. but it does come with a price. So our complete onboarding price is $14.25. And for those of you that are listening that are like, oh, that's crazy, that's outrageous, and because you're new to this world, I totally get it, but I will tell you that is a quarter of the price of what you will spend if you have to pay for all of those private labs, because most of those labs will rack up to a couple of $1,000s, and you will not be guaranteed to know what's wrong with you. And that is why we do it the way we do it now. But the best thing about it is we do always advocate for working with families. And if you decide that you wanted to join on with a spouse, it's $14.25 for the first person, but any additional family member is $5.97 for the same exact testing. But most importantly, we want to make sure that we are a good fit for you as you are a good fit for us. So I'm going to actually pop this up in here and you can take a look at it. But we have a way for you to hop on a strategy call to learn a little bit more about who we are and what we do, so that you can really just kind of understand the entire process. And then our care team can give you a little bit more insight about how it all works, because we do work with people long distance. One of the things that I didn't reveal so far is that your hair contains your DNA. So with being said, because some of our tests are DNA based, we can actually do a lot of your testing from a distance utilizing the DNA in your hair. And then for those of you that are listening that are very interested in the course of care that we offer, because it is very, very, very unique and very comprehensive, we offer everything from immersion weekends to immersion weeks. I actually have 3 people here this week that are from all over the country, which has been amazing because these people get such amazing results in a short amount of time. Literally had a mom in tears yesterday because her daughter is suffering from debilitating neurological issue called PANDAS. And she said that she slept through the night for the first time in 5 years. And she also did not have a headache and did not have any problems speaking. She actually has a lot of problems with her speech. And that was after 1 day of treatment. So that's pretty remarkable. And it's really what gets me excited about what I do every single day. And I've already kind of touched on this, but the unique onboarding process at the end of the day is to save you money up front, because it's going to cost a lot more if you're doing all of those private labs. So we really try to make it reasonable so you can figure out what's going on sooner than later. All right, so I have no questions tonight. If you have any that pop up, feel free to pop those in. Otherwise, you can definitely check out the link to the strategy call. There's tons of information on our website as well, so definitely head over there if you have, if you're looking for anything else in addition. But lastly, I just want you to know that, these webinars are such an amazing educational experience. But when it comes down to you being able to figure out what's going on with you and being able to have a roadmap, that's when this becomes a breakthrough experience. This is, I love doing these things because I love opening people's eyes to what's out there. But, the transformations that we see on a day-to-day basis is just amazing. And I really just, I can't tell you how much I love what I do, and being able to see people's lives transform is really just, I feel very, very lucky and very grateful for that. So I thank you guys for being with me, and our website, integratedwellnessgroup.com, check it out. Next week, we're actually going to be talking about autoimmune brain conditions. So definitely share the link with anyone who is dealing with any type of neurological conditions in the world of PANS or PANDAS, or any other types of severe neurological conditions. So I will see you guys next week. Thank you again for joining.